preparing stone study models for wax up for porcelain veneers. Lower, upper, this is the preoperative upper model. Now the reasons that we're doing this is because if you're only reducing the facial surface of the tooth a 1/2 millimeter and you try to fabricate the provisionals from a matrix made from the pre-op model, there's not enough thickness of bisacrylate provisional material to work with. So what we're doing, we're actually waxing up the facial surface of the preoperative model about a 1/2 millimeter to 1 millimeter thicker. From that wax up, we'll fabricate a polyvinyl siloxane matrix, and from that we will fabricate the provisional restorations. The pre-op model, pre-op lower or mandibular model, I'm going to cut this tooth, this facial verted tooth, back into the correct arch alignment before the wax up. So these are the pre-op models. I'm going to take a Brasileir two-sided diamond disc and cut between any teeth that are crowded or any teeth that I want to alter the mesial distal width. So you can see I'm cutting all the way through the crowded mandibular lateral incisor on the stone model with this two-sided diamond disc. So this tooth was also a little bit crowded, and that gives your technician, I'm going to go ahead and cut between all of these so he can idealize the mesial distal width in the wax up. And he's also going to widen or make the facial surface a little bit thicker. And now I'm cutting this facial verted tooth back into the arch alignment with a acrylic burr prior to the wax up. So I've cut between the teeth, and now I'm cutting it back. Any tooth that's facial to the ideal arch alignment, I'm cutting it back into the arch alignment. Don't worry if a tooth is a little bit lingual verted. You don't have to cut that one back into the arch alignment, because the key is we're adding wax to the facial. And this tooth's just a little bit facial verted, so I'm cutting it back into the arch alignment too. We're only waxing up from cuspid to cuspid in the mandibular arch because we're going to place full crowns, full porcelain crowns, Emax or zirconium to porcelain crowns on the mandibular bicuspids. Now I'm going to take a 15 barred Parker blade and just round the interproximal facial line angles where I've cut between the teeth with the disc. Now I'm just going to round those line angles. This whole process for both models probably takes me 5 minutes, maybe less. So here's the wax up. On the maxillary teeth model, I didn't need to cut between the teeth because there was no crowding. We're only adding wax to the facial of the maxillary anterior teeth, and we may lengthen the teeth just a little bit. If we are, then we'll add a little bit of wax to the incisal, and then we're adding wax to the facial of the mandibular anterior teeth. So we're veneering all the way to the second bicuspids of the maxillary arch, and you'll see how the wax has made the teeth wider facially. So once we reduce the teeth on the facial a 1/2 millimeter, and then we have fabricated the provisional matrix off the wax up model, where we place bisacrylate in the matrix, which was fabricated from the wax up model, we're going to have about 1 millimeter of material, provisional material to work with, so it's not so flimsy. Here's before and after, before and after. That's the dental minute. These procedures work, and they work every time.